taking a look at your health now as we head into spring and the weather gets nicer. It also means that allergy season is on the way. I feel like it's already here.
Oh, yeah, we've been feeling it for sure. And with the coronavirus pandemic still around, it may be hard to figure out if the sniffles you have because of allergies or maybe symptoms of COVID. So joining us live to clear the air is Dr. Mary McKenzie from Legacy Health. Good morning, doctor.
Good morning. How are you?
Oh, you're doing well. I know it's one of those things where, like, if you're out and you sneeze or something, even with a mask on, I feel like, oh my gosh, are people going to think I have COVID-19? So
Yeah.
what are the differences between the symptoms of allergies and COVID?
Well, I admit it can be difficult. I think that there can be a lot of overlap. Um, Items that I would think about, though, are when you think about COVID-19, you think about a lot of fever. Often people can have stomach issues such as nausea and vomiting. When you think about allergies, those are more kind of itchy eyes, nasal congestion. They both can have sore throat and fatigue just from that nasal congestion. But I think that fever and some of those stomach upset issues are a little bit distinguishing. You can also kind of look at the timing of it. So if you're kind of having more symptoms and the pollen counts are going higher, then that would be something to look at for something maybe more likely to be an allergy.
I know this happened to me this past weekend. I spent the whole weekend outside, and by Sunday night I had a little bit of a scratchy sore throat going on, and your
Mhm,
mind immediately starts to panic. But
mhm,
I've been taking my temperature daily since we still come into work, and
mhm.
no fever. So I think
Yeah.
I tried not to go down the WebMD rabbit hole, and I'm guessing that's not something you want people to do if you start to get the sniffles.
Well, I think what I would say is if you are a person who's had allergies every spring, or you're a person who gets them in the fall, maybe with moldy leaves, and this is happening to you again, I would kind of trust your knowledge about your body. So if this is something that happens to you every spring and you're getting those exposures, as you said, by going outside, then I would kind of think more about allergies. And I would try to do those things that the CDC is saying about minimizing your risk for COVID, such as wearing your mask, getting your vaccine, staying 6 feet apart, and not going to large gatherings.
Yeah, and what are some other precautions you can take as far as your allergies? I know we had a story in the news recently
Yeah.
about wearing a mask, how that can maybe even help with the allergy component of it.
Yeah, so allergies, it's all about exposure to those tiny little pollens and getting into your respiratory tract. So there are very reasonable steps you can take. For example, wearing a mask is one option. Otherwise, when you come indoors after you've spent some time outside, take a shower, change your clothes. That can minimize your exposure. You can also make sure that your windows are closed during high pollen counts and that you have a filtration system in your house that involves a HEPA filter to pull out all the pollens. So some kind of very basic steps to just minimize the burden that you get, especially when these pollen counts are so high.
Yeah. Now, doctor, if you do suspect that you may be coming down with COVID, is testing still readily available? What do you suggest people do?
Well, I think if the symptoms are persisting and it doesn't seem like you're having symptoms and you don't have a history of allergies, then that would be something to go to your healthcare provider and talk about. We do have a much higher capacity of testing than a year ago for sure, but even than 6 months ago. So I think if you feel like you are not a person with a history of allergies, you're having some of those respiratory symptoms, then it's time to talk to your healthcare provider.
All right, Dr. Mary McKenzie from Legacy Health, thanks for being with us this morning.
Happy to be here. Thanks.
Yeah, and of course, this interview, along with all our other coronavirus related resources and information, can be found anytime on coin.com.